Hey guys, welcome to my YouTube channel, Dr. Vaibhavi's Orthodontic Insight. I believe this is going to be your go-to destination for in-depth orthodontic knowledge and education. So let's dive in and learn together. Today's topic is the Goslon Yardstick. It is a system of assessing dental arch relationships in children with unilateral clefts of the lip and the palate. So, who developed this yardstick? The collective effort of these five doctors, they resulted in this system. So, the first two, that is Dr. Michael Mars and Dr. Dennis Blint, they were consultant orthodontists working at Hospital for Sick Children, Great Ormond Street, London, England. Dr. Hurston, he was a professor of orthodontics in London, and Dr. Bergland and Dr. Sam, they were affiliated with University of Oslo, Norway. The Goslon Yardstick, it is a clinical tool that allows categorization of dental relationships in late mixed and early permanent dentition stage into 5 discrete categories. It is a widely used index to evaluate the effectiveness of treatment for patients with unilateral clefts of the lip and the palate. So, what were the objectives of this study? The first objective was to categorize the malocclusions in patients with unilateral clefts of the lip and the palate in a way that would represent the severity of the malocclusion and the difficulty of correcting it. The second objective was to introduce a method that is simple to use and highly reliable even when used by different observers. So, we are going to study this yardstick under 3 stages. The first is development, second is its application, and third is its testing. So, in the initial study, children with unilateral clefts of the lip and the palate were included, all of which belong to the early permanent dentition stage. As at this stage, the skeletal and dental problems they clearly manifest, and at which the definitive orthodontic and surgical treatment are usually planned. So the first stage is the development of the yardstick. There were 3 clinical features which were considered most important in categorizing malocclusion in unilateral clefts of the lip and the palate patient. The first one is anterior-posterior arch relationship, second is the vertical labial segment relationship, and third is the transverse relationship. This is in a descending order, which means that the anterior-posterior relationship is considered of greatest importance and generalized crowding or some irregularity is agreed to be relatively unimportant. So initially 30 cases were included, all of which were in the early permanent dentition stage. They were selected from the files at Hospital of the Sick Children at Great Ormond Street, London. All the cases selected, they never had received any kind of orthodontic treatment or received the treatment for correction of the anterior crossbite at a very early age, not more than that, right? So all these models of those selected cases, they were then subjectively ranked by 4 experienced orthodontists independently. Once the ranking was completed, the ranking was again repeated after an interval of 1 week, and then the reliability was measured by Spearman's rank correlation coefficient. So once the ranking was done, these cases they were readily separated into 5 different groups which form the basis of the yardstick. But firstly, from these 30 cases, 8 cases they were found to be in the borderline situation, so they were excluded. Remaining 22 cases they formed the basis of the Goslon yardstick. So, Group 1 included the excellent cases, Group 2 good cases, Group 3 fair cases, Group 4 poor, and Group 5 very poor cases. The cases included in Group 1 and Group 2, they had occlusions that require either straightforward orthodontic treatment or none at all. Here, from the models of Group 1 and Group 2, we can appreciate they both have a positive incisal relation. In Group 3, cases require complex orthodontic treatment to correct class 3 malocclusion, but a good result can be anticipated. Here we can appreciate an edge-to-edge anterior incisal relationship. In Group 4, the cases are at the limit of the orthodontic treatment without any orthodontic surgery to correct the skeletal malrelation. Here we can appreciate that the models of the patients, they are having anterior reverse bite. In Group 5, the cases require orthodontic surgery to correct the skeletal malrelation if there is to be any possibility of obtaining satisfactory occlusal relationship. So, second stage is the application of the yardstick, wherein the stage 1 is anterior-posterior assessment. Here the overjet is examined first. That is, a positive overjet means the case is less severe, and the reverse overjet means the case is more severe. Second stage, vertical assessment is done. Here the favorable feature is a deep overbite. Modification of the provisional category in case of borderline cases can be done on the basis of vertical assessment. Example, a case placed at a borderline between stage 3 and stage 4 on the basis of the anterior posterior assessment. With deep bite, it might be conformed to Group 3, but in case if the patient is having an open bite, it would be transferred to Group 4. This third stage is transverse assessment. Normal transverse relation or crossbite that can be corrected orthodontically, it does not indicate a change of group. But in case of marked narrowing of the upper arch with bilateral crossbite, that would indicate a more severe category for a case that is already on the upper limits of the group for some other reasons. So the third stage is the testing of the yardstick. Once it was developed, it was done tested. 55 sets of the study models, they were included in the testing of the yardstick, all of which belong to the patient in the permanent dentition period with a mean age of 12 years and a standard deviation of 1 year and 6 months. All of the files, they were retrieved from the patients of Oslo Cleft Lip and Palate Clinic. No cases were excluded after the initial selection. All the study models, they were assessed by 4 assessors at 2 separate occasions. The bias was found not to be significant and was tested by the Wilkinson's test. The reliability was judged by Spearman's rank correlation coefficient and was found to be very high. Thus, it was concluded that Goslon yardstick was sufficiently reliable for the general use. So, with this, we end our first topic, that is the Goslon yardstick, and thank you so much for your appreciation. Goodbye.